My name is Sadie Miller, and this is my informative speech on depression, and these are my audience members. When you hear the word depression, what do you think? Many would answer things such as, it is when people are sad and contemplate suicide, but it is so much more than that. There are many varieties of it. Types of depression can affect anyone. It doesn't matter your race, size, or religion. These awful forms of mood disorders can be caused by many different things. Depression can come and go for some, but the mental damage it leaves you with can always reoccur. For others, with a more severe form, will have to overcome daily issues forever. By the end of my speech, I hope that all of you will have a better understanding of what people with depression go through and struggle with on a daily basis and respect them. To start off with, you need to understand the basics of depression. What is depression? It is a severe despondency and dejection felt over a period of time, accompanied by feelings of hopelessness and inadequacy. You may not know what these words mean, so despondency is when you have very low spirits that are usually a reaction of losing your hope and courage. Dejection is when you also have very low spirits and feel sad and depressed. Inadequacy is feeling as though you aren't worth anything. Depression is a serious medical condition. Symptoms of it are low energy, tiredness, trouble sleeping, worthlessness, guilty for no reason, hopelessness, sadness, irritability, and weight change. If you have any of these symptoms, look into what type you might have immediately so you can find treatment that works best for you. Causes of it could be environmental issues, death of a loved one, marital issues. They are questioning if there is a depression gene as well. Doctors are studying people with depression to determine if it is hereditary and to help find better treatments. It has been common that if someone in your family has depression, you are more likely to have it. Depression affects 14 million people every year. That would mean that 1 in every 10 adults have some form of depression. Here are the many faces of depression. Depression is the imbalance of chemicals called neurotransmitter and neurotransmitters. This is what someone who's depressed, this is what their brain looks like, the chemicals in it. And someone who's not depressed, this is what their brain looks like, their chemical balance. Okay, there is major depressive disorder, which means that they have at least one major episode in a day, or 5 or more symptoms for at least a 2-week period. Dysthymia is a low-level state of depression that goes on for a long period of time. Symptoms of it are low self-esteem, pessimism, despair, hopelessness, loss of interest or pleasure, social withdrawal, tiredness, guilt about the past, feeling of anger, difficulty thinking such as poor memory, poor concentration, or indecisiveness. The symptoms of it last more than 2 years in adults and 1 year in children. People don't usually know they have it. They believe it's just a part of their personality. 3 to 6% of the population actually has it. It occurs in young kids more often than major depressive disorder or bipolar disorder does. People with this sometimes have episodes of major depression, which professionals label it as double depression. The treatment of it can be medication, psychotherapy, or peer support. Another kind is postpartum depression, which is a treatable medical illness. The symptoms of it are sadness, exhaustion and anxiety after birth of a child, anger, wanting to harm the baby or yourself, fear of being a bad mom, and you can't enjoy your child. It can affect anyone. 1 in 10 women get it. The cause of it is not exactly sure. They are assuming that is because when you have a baby, you go through so many changes and there are so many chemicals going through your body. And that is when women feel like that is why women feel like this after giving birth. What puts you at risk is history of depression in you or a family member, poor social support, unhappy things happening during your birth, the birth of a baby or your pregnancy, an unstable marriage or relationship, or feeling unsure about your pregnancy. When you have postpartum, you feel as though you are a bad mom, but you feel ashamed and you don't want to tell anyone, even though you need to because it is the best thing for you and your baby. Many women don't get help because society makes people think that they need to be happy when they have a child, not upset. The treatments of it are meds, therapy, support groups, eating balanced meals, or using a journal to vent about how you feel. Then there is a more extreme form of depression, which is bipolar disorder. The definition of it is extreme changes in mood, thought, energy, and behavior. It's called bipolar because the moods go between the poles of extreme highs to major depressive lows. It can last for hours, days, weeks, or months. Someone with unipolar has similar symptoms, they just don't go through extreme highs where they act like a maniac. Seasonal affective disorder, also known as SAD, is a depression that occurs at the same time every year. Most cases start in the fall and continue through the winter because those are the times when you are least exposed to the sun. For some it will occur in the spring or summer though. The feelings that you have when you have SAD are no energy and moody. The treatment of it is light therapy, where they place the patients in front of a strong light that has similar traits to the sun. Seems to be the most effective. And then there is psychotherapy or medications, and in very few cases, but sometimes doctors will recommend tanning in a tanning bed because they also mock the sunlight rays, and that has been known to help with SAD. I'm sure you noticed most of the treatment recommendations for all forms of depression had a lot that were the same. When they say medications, they mean antidepressants. There are many different kinds that have different strengths depending on the severity of a person's case. The problem with antidepressants is that they have many side effects, such as being unable to sleep, feeling dizzy, or having quite a bit of weight gain. Plus, they control your emotions. It makes you feel as though you have little to no emotion. Sometimes people have encountered short-term memory loss from antidepressants. Then there is psychotherapy, which is when you confide in a therapist about what you are feeling. The hope is to work on improving a person's mood and help find ways to cope with their depression. Then there is electric shock treatment, which is electroconvulsive therapy, also known as ECT. It's only used in very severe cases when the medications really are not working for people. Then there's interpersonal therapy, which is mostly used when children obtain a form of depression, to explain to parents and their child about group sessions, techniques, and what to expect. In children, you can see that talking to a medical doctor or other professional helps the most out of all of the ways to make it better. And then in adults, it worked best to talk to a professional or use prescription medication. But there is no prevention to depression. It can happen to anyone at any stage of life. Even famous people like Abraham Lincoln and Jim Carrey were diagnosed with some form of the mental health issue. People you would never guess that would have it easily could. They have to face inner demons every day. 97% of the people that have depression say that it causes issues with social things, home, work, and/or their relationships in life. You will never fully understand what people with depression go through and feel. They don't care whether you understand. They just want people to accept that there are people out there who suffer from the illness. When you have depression, it really does control your brain, which makes you not want to be alive anymore. If you know someone who is fighting the disease and they confide in you, don't ever tell them that it upsets you when they talk in a depressed way. Think about how they feel. They have to deal with their brain telling them to take their own life every day. The best way you can help someone is to be a true friend to them. Pain from depression is a real occurrence. No matter what the reason be that they are so upset, let them talk to you. Another thing to remember is that their actions are now controlled by the illness. Don't judge them for the things they do. Get them help and contribute to their healing in a positive way. It's not that these people want to be so sad. They wish they could find happiness and hope in life. But when you have it, you no longer have the ability to see life clearly. Do you get it now? Depression is not a choice. Depression is an illness, not a personal problem. It is impossible to just get rid of. Healing from depression takes lots of help from loved ones. I hope you caught on to all of the struggles prisoners of the illness go through, no matter what form they have. Society tends to assume it's their fault and wants them to feel guilty. Why should they ever have to apologize for their health issues? They don't ask you to apologize for yours. When you realize that someone has depression, tell them how much you admire their fighting strength. Don't ever make them feel like less of a person than any other human being. Be a help to their healing. Don't add to their issues.